Hello guys. I'm creating a video to spread awareness for attention deficit hyperactivity disorder, also known as ADHD, which is a neurodevelopmental disorder that affects approximately 4% of the population. Now, the word neurodevelopmental means that it is an issue that is caused in the development of the brain. More specifically, part of the frontal lobe develops at a slower rate compared to the rest of the brain when ADHD is present. This causes our dopamine neurotransmitters to not work properly and gives us lower levels of dopamine. This forces our brains to look for dopamine stimuli in external factors, hence the hyperactivity and lack of attention. Now, if you do have ADHD, do not worry. Although this explanation makes it seem a little bit worrisome, nowadays there are a lot of alternatives for medication that can treat it. Now, let's start with possible symptoms. If you do notice symptoms, do not be alerted. It does not mean you have ADHD, and by no means self-diagnose, please. If you have suspicion, please visit a doctor and get medically checked. Now, here's a list of symptoms. Makes careless mistakes and lacks attention to detail. Lacks sustained attention in tasks or fun activities. It is a poor listener, even in the absence of obvious distraction. Fails to follow through on tasks and instructions. Difficulty with organization, time management, deadlines. Avoid tasks requiring sustained mental effort. Loses things necessary for tasks or activities. Is easily distracted, including unrelated thoughts. Forgetful in daily activities. Procrastinates and puts off tasks until the last moment possible. Fidget, taps hands, or squirms in seat. Leaves seat in situations when remaining seated is expected. Excessive running, climbing, or feelings of restlessness. Often on the go, acting as if driven by a motor. Difficulty with quiet leisure activities. Excessive talking. Blurts out answers before questions are even completed. Difficulty waiting their turn. And interrupts or intrudes on others. Now, as you can see, all of these symptoms can be quite normal or common. It does not mean anything, but get tested if you're suspicious and before you self-diagnose yourself, please. Now, these symptoms can be manifested in work in the following ways. Does not follow through on instructions and fails to complete tasks, overlooks or misses details, is often restless and leaves seat inappropriately, and there's a clear evidence that the symptoms interfere with a social, academic, or occupational functioning. If you do experience these symptoms and see them manifest in the previous ways at school, then I do recommend at least getting an evaluation done. Now I'm going to talk about ADHD medications and all the different types. Which ones do I recommend? But of course, before taking any means to try to medicate your ADHD, first talk to a doctor and obviously get your treatment from him. ADHD medications, at least the pills, are stimulants, which stimulate the production of dopamine neurotransmitters in your brain to balance out the lack of them due to ADHD. This can help with the symptoms of ADHD, which include lack of attention span, focus, and impulse control. Although during some instances, ADHD medication has proven to improve scores in standardized tests, this success cannot be directly correlated to ADHD medication. ADHD medication seems to only control symptoms but not actually improve learning abilities in children. In a study conducted by the National Institute of Mental Health, children seemed to perform the same with ADHD medication and the placebo medication. These kids had an improvement in the amount of work done during class but performed the same in tests. These results support the fact that ADHD medication has no long-term effect or solution. Make sure to get medically approved and prescribed if you do take any ADHD-intended medication. Now, another useful alternative to ADHD medication include behavioral therapy, academic strategies, and parent training. These seem to genuinely engage children and fix their learning issues from the root. Once they learn these strategies, they will keep practicing them for the rest of their lives, which can also help them understand their condition a lot better. A good analogy would be comparing a knee injury, which causes extreme amounts of pain in the patient. One doctor provides strong medication and steroids to numb the pain, which requires constant application but does not heal the injury. The other doctor, who offers a small surgery and therapy to help the knee, becomes as strong and useful as it used to be prior to the injury. Right now, most doctors give the first option of medication as it is more convenient but has poor results in the learning abilities of children. Although medication is not completely useless, it is still recommended to utilize, but always in hand with the rest of the strategies and only if deemed necessary. This is because ADHD medication can also have negative effects on children in the social aspect of their lives, which can have a great impact on their learning abilities. Now, if you're wondering what to do if you know you have ADHD, or you're worried that you might, here's a website to visit in case you're worried. This website is from the ADDA, which is the largest organization for ADHD. They provide information, resources, and networking opportunities to help people with attention deficit hyperactivity disorder. Make sure to go to your doctor and get diagnosed if you're suspicious of possibly having ADHD. Do not self-diagnose, and any medication or treatment that you take, make sure it's medically approved and prescribed. Remember, there is nothing wrong with you if you do have ADHD, and it should not limit you at all. I will leave a link to the website so y'all can visit that. If y'all have any questions, please let me know. Thank you.